Hi, Cliff again. This next video is about staging of the cancer. And it's important for us to understand the staging so that we can discover what treatments are available to help you out.
Welcome to this video on rectal cancer staging. This video is meant to be a helpful tool for how we stage rectal cancer. You can use this anytime during your diagnosis and treatment. Staging is important because it guides your cancer care. Not all of the information in this video will apply to you specifically. Talk to your doctor about your specific cancer stage. If you have not watched the rectal anatomy video, please do so first, as this describes the images you will see in this video. We encourage you to have a pen and paper ready to write down questions you may have during this video. Please feel free to pause this video at any time. The goals for this video are to talk about what cancer staging is, how we stage, and an overview of the stages of rectal cancer. The stage of your cancer is how deep the cancer has grown into the rectum and if it has spread to other parts of the body. This is important because it helps your medical team understand your cancer and helps guide what treatments are available. We stage rectal cancer in two ways: blood tests and scans. Scans are also known as imaging. We get a blood test called a CEA level, which is a tumor marker for rectal cancer and colon cancer. This blood test will help us understand more about your cancer. The CEA level is also a test that we recheck many times during and after your treatment to monitor your cancer and recovery. In terms of scans, we get an MRI, or sometimes an ultrasound of the pelvis, and CT scans of the chest, abdomen, and pelvis. The MRI helps us understand how deep the tumor has grown into the wall of the rectum, and if there are suspicious lymph nodes in the fat layer of the rectum that may have cancer in them. The CT scans help us understand if the tumor has spread in other locations away from the rectum, such as the liver and lungs. You may hear your doctor talk about TNM for your rectal cancer stage. T stands for tumor and is how deep your tumor has grown into the wall of the rectum. N refers to lymph nodes, whether they're suspicious or not. And M stands for metastasis, which is if your cancer has spread into other locations away from your rectum. The medical team uses this system to help stage your cancer. For this video, we are going to simplify staging to make it easy to understand. There are 4 different stages of rectal cancer that we will go over: stage 1, stage 2, stage 3, and stage 4. In stage 1, the MRI shows that the tumor has grown through the lining of the rectum, but not through the muscle layer of the rectum. There are lymph nodes that are not suspicious for having cancer in them. The CT scan shows that there is no spread anywhere else in the body. In stage 2, the MRI shows that the tumor has grown into the fat layer, or through the fat layer completely. There are lymph nodes that are not suspicious for having cancer in them. The CT scan shows that there is no spread anywhere else in the body. In stage 3, the MRI shows the rectal tumor at any size. There are lymph nodes that appear suspicious for having cancer in them. The CT scans show that there is no spread anywhere else in the body. Stage 4 is the most advanced stage of rectal cancer. The MRI shows the rectal tumor at any size. There are lymph nodes that are suspicious for having cancer in them, or not, but the CT scan shows that there is spread anywhere else in the body, such as in the liver and/or the lungs.
Staging guides your cancer care. You will undergo imaging and blood work. There are 4 stages.
Special thanks to all our patients and colleagues who helped develop this video.